An enlarged prostate is one of the most common health issues that men face as they get older. If you've ever heard terms like a weak urinary stream, frequent nighttime urination, or trouble fully emptying your bladder, these are often linked to prostate enlargement. But here's the key point. An enlarged prostate is not a single disease. It's a finding, and there are three main causes behind why you might have an enlarged prostate. Understanding these causes can help you know what's normal and what needs treatment, and what could be more serious. Hi, my name is Dr. Lamia Gabal, and I'm a board-certified urologist practicing in Southern California. The most common cause of an enlarged prostate is benign prostatic hyperplasia, also more commonly known as BPH. This is a non-cancerous growth of prostate tissue that happens naturally with aging. As men get older, the prostate responds to hormones like testosterone and dihydrotestosterone, causing both the glandular and the supportive tissue to grow. This condition is extremely common. About 25% of men in their 40s have some degree of BPH, and that number rises to over 80% in men in their 70s. Globally, millions of men are affected, and the number continues to rise as the population ages. Many men with BPH have no symptoms at all. However, when symptoms do appear, they usually involve the urinary tract. These include a weak urinary stream, difficulty starting urination, frequent urination, especially at night, and a feeling of incomplete bladder emptying. These symptoms happen because the prostate surrounds the urethra, and as that gland enlarges, it compresses the urethra tube. The important thing to understand is that BPH is not cancer, and it does not turn into cancer. However, it can significantly affect quality of life if the symptoms become more severe. The second major cause of an enlarged prostate, however, is prostate cancer. And while less common than BPH, this is the most commonly diagnosed non-skin cancer in men in the United States. Prostate cancer can also cause the prostate to enlarge, but it normally behaves very differently from BPH. In many cases, especially early on, prostate cancer does not cause any symptoms at all. This is why screening with a PSA blood test and a physical exam with a digital rectal exam is so important. When symptoms do occur later in the disease process, they can look very similar to BPH, including urinary changes like weak flow or increased frequency. This overlap is why further testing is often needed when an enlarged prostate is found. One important clinical detail is the role of PSA or prostate-specific antigen. Men with PSA levels between 4 and 10 have about a 30 to 35% chance of having prostate cancer. If the PSA rises above 10, the likelihood increases to more than 60%. There's also some evidence that men with BPH might have a higher risk of developing prostate cancer, although this is likely just because these men get more screening and the two things are distinct entities. But this is why you need regular monitoring, and the key takeaway is that prostate cancer is less common than BPH, but it must always be ruled out. The third major cause is prostatitis, which refers to inflammation of the prostate. This condition is different from the first two because it's often driven by infection or chronic inflammation rather than simple growth. Prostatitis can show up in several forms. Acute bacterial prostatitis is a sudden and often severe infection that causes prostate swelling, pain, fever, and urinary symptoms. Chronic bacterial prostatitis involves recurring bacterial infections, while abacterial prostatitis or chronic pelvic pain syndrome can cause long-term discomfort without clear infection. This condition is also quite common, and studies suggest that up to 25% of older men may experience some form of prostatitis during their lifetime. Unlike BPH, prostatitis often comes with pain. Men may feel discomfort in the lower abdomen, pelvis, or even the lower back. Urination may be painful, and there may be urgency and frequency to urinate. Another important point is that prostatitis and BPH often overlap. Men with a history of BPH are more likely to have prostatitis due to the enlargement, and vice versa, when the prostate is inflamed, it causes more enlargement. And so understanding the cause of prostate enlargement is key to proper treatment. When a prostate is enlarged, the next step is figuring out why. BPH is the most common and often the most manageable. Prostate cancer is less common, but must always be ruled out because of its seriousness, and in this day and age is still also quite manageable. Prostatitis adds another layer, especially when pain or infection is involved. The symptoms alone are often not enough to tell these apart, and that's why we rely on a combination of history, physical exam, PSA testing, urine studies, and sometimes imaging or biopsy of the prostate as well. So if you're experiencing urinary symptoms or have been told that you have an enlarged prostate, the next most important step is evaluation. Not every enlarged prostate is dangerous, but understanding the cause is what guides the right treatment and protects long-term health and bladder health. What questions do you have about your urinary tract health? Drop them in the comments below and I'll do my best to do a future video on it. Thanks for watching, and remember to hit like and subscribe, and I'll see you in the next video.